This segment will review the plexi of the lower limb that are formed within the pelvis and the branches that will exit to make their way down to the limb. This is a model that contains part of the pelvis and also part of the lower posterior abdominal wall. So we can see here that the pelvis has been sectioned on either side, and that would be a coronal section. And then all of the contents of the lower abdomen and pelvis have been removed. And in addition to that, we can see here that we've got more bits of bone that have been cut, and they are the pedicles of each of the vertebrae. And so the entire body of each vertebra has been removed so that we can see into the vertebral canal that lies behind it. So effectively then we've got an anterior view of the vertebral canal space, and then we can see some of the nerves coming out on either side. We've talked previously about spinal nerves and the fact that those spinal nerves have ventral and dorsal rami, and particularly we've talked about the fact that the ventral rami will form the plexus that makes up the nerves coming down to the lower limb. So on this model we can see that at each level, and perhaps we'll just use this one in particular, at each level we can see a spinal nerve emerging through what would be an intervertebral foramen. And we can't see the dorsal ramus here because it would go out through the back of the model, but what we're seeing is the ventral ramus of each spinal nerve coming out and joining to form nerves that are part of these plexi making their way out to the lower limb. We're then going to look at each of these in a bit more detail.
We've just been looking at some nerve plexi and their branches on a model, and I want to review briefly some principles related to these plexi. The first is that all spinal nerves divide into posterior and anterior primary rami. We met the posterior primary rami as part of the vertebral column module in that they were supplying structures of the back, but we're now particularly interested in the anterior primary rami as they're the ones that supply all other somatic structures, importantly including the limbs that we're dealing with now. The second principle is that a nerve plexus actually redistributes the nerve fibres from these anterior primary rami into a number of different peripheral nerves that are formed by that plexus. So it's the redistribution of the nerve fibres from individual spinal segments. If we look at a text version of the plexi of the lower limb, firstly we can see that there are two plexi, the lumbar plexus and the sacral plexus, sometimes known as the lumbosacral. If we look at the lumbar plexus first, we can see that it's formed by the second, third and fourth lumbar ventral rami. And the major branches arising from that are the femoral, the obturator and the lateral cutaneous nerve of the thigh. The formation of the sacral plexus is slightly different in that two ventral rami come down effectively from the lumbar plexus, forming what's called the lumbosacral trunk, and this joins with the ventral rami of S1, 2 and 3. And the major branches deriving from that plexus are the sciatic nerve, which is in fact, as we'll see later on, a combination of two nerves, the tibial and the common peroneal, the superior and inferior gluteal nerves, the posterior cutaneous nerve of the thigh, and there are some other smaller branches. If we look at a diagram like this, it looks somewhat similar to the model that we saw previously, except we're only seeing the bones and the nerves on this diagram. We can see quite clearly the lumbar plexus up here, derived from the ventral rami of L2, 3 and 4, and we can see the nerves that derive from that primarily being the femoral nerve, the obturator nerve, and out here the lateral cutaneous nerve of the thigh. We can also see on the other side here the sacral plexus, and it's formed by the L4 and 5 ventral rami, forming this lumbosacral trunk, joining with the S1, 2 and 3 ventral rami. Now we can see that it actually exits through the posterior aspect of the pelvis here, so some of the branches are hidden, but we can see some of the major branches being the sciatic nerve and also the posterior cutaneous nerve of the thigh continuing down here. What we can't see is some more detail about how these nerves are made up. So for example, if we look at the lumbar plexus, we can see that the obturator nerve here has branches from L2, L3 and L4. The femoral nerve, in fact, is also formed by L2, L3 and L4. So in other words, we're seeing the redistribution of fibres from those three segments into two different peripheral nerves. But how do those nerves differ? We're going to have a look at a diagrammatic version of a nerve plexus now to try and explain this. One of the particular features of this that makes it diagrammatic, as I say, is that the spinal cord is also shown on this diagram. So we can see here the segments of the spinal cord. Now in fact we know from our previous study that the spinal cord actually finishes at the L2 level, and the nerve roots indicated by these black lines on here actually continue down as the cauda equina to exit as spinal nerves down at these lower lumbar and sacral levels. So in fact it is diagrammatic, but it allows us to see the contribution of the spinal cord to the plexus. If we took any individual spinal nerve, we know that it's made up of motor anterior roots and sensory posterior roots that join to form the spinal nerve. If we then looked at any individual spinal nerve, we can see that it divides into ventral and dorsal rami, as indicated by the key at the top here, and it's only the ventral rami that we're interested in, so that we can see that the dorsal rami on this plexus diagram are disappearing off into the back. What we can see now on this one is that each ventral ramus divides into anterior and posterior divisions, again as indicated on the key at the top here. And all of the posterior divisions from L2, 3 and 4 join to form the femoral nerve, whereas the anterior divisions of L2, 3 and 4 join to form the obturator nerve. Now we're going to talk about the functional significance of that later on, but that's the basis for the formation of these two main nerves. And we can see that the cutaneous nerve, that is the one that's only supplying skin, we're not that fussed about divisions, but we can see it has branches from L2 and L3. Similarly, if we look at the branches emerging from the sacral plexus, we've got superior and inferior gluteal coming from the upper segments, but particularly from posterior divisions. The common peroneal nerve comes from most of the segments, but again posterior divisions, whereas the tibial nerve comes from all of the segments, but now they're the anterior divisions. And again, the posterior cutaneous nerve of the thigh, we're not so fussed about divisions, but we can see it gets branches from particularly S2 and S3. The nerve that's missing on here is the sciatic nerve, and that's because in fact, as I indicated previously, it's really a combination of two nerves that travel together for a short time. So they emerge in the gluteal region as the sciatic nerve, and later on they'll divide separately into the common peroneal and tibial.
So we've seen a diagrammatic version of the plexi making their way to the lower limb. We now want to have a look at where those nerves actually make their way out of the pelvis. Now again, this is not a complete pelvis, but we can see large parts of it, and you can perhaps access other diagrams. But what I want you to do is to identify the exits that each of these nerves takes to leave the pelvis. So on this diagram we can see here formed by L2, 3 and 4, this is the femoral nerve making its way anteriorly in the pelvis. Also formed by L2, 3 and 4, here's the obturator nerve taking quite a different course down here into the pelvis. And finally formed by parts of L4, L5, S1, 2 and 3, this is the sciatic nerve making its way out of the pelvis posteriorly. What I'd like you to do is, based on your knowledge of the openings of the pelvis and their locations, decide which of those openings each of those three nerves will make their way through. You can pause the video now. Hopefully you've been able to come up with answers for those questions. As we said, this is the femoral nerve, and in fact it will follow this muscle that it's lying superficial to. This is the iliacus muscle, and both of those structures will make their way anteriorly to leave the pelvis deep to the inguinal ligament, even though it's not quite visible on this diagram. In contrast, the obturator nerve makes its way from the false pelvis down into the true pelvis, and then it will exit out through the obturator canal. And finally, the sciatic nerve, as we said, we can see it going out posteriorly, and this is the greater sciatic notch here, so it's making its way out through the greater sciatic foramen of the pelvis posteriorly.